Good afternoon. It's a great pleasure to be able to be here to speak at this session, and I'm thrilled that there is a session on integrative medicine for this audience. This is an area that is critically important for improving cancer outcomes. And what I will do for the next 20 minutes or so is give you an overview of the field as a whole, and in particular, how we work with patients from a clinical perspective at MD Anderson. If there's time permitting, I'll give you a very brief sketch of what we're doing in terms of research. I believe everyone is aware of some of these staggering statistics of what's going to be happening in the future for oncologists and the number of patients needed to be cared for. Not as relevant here as the US incidence, but the world incidence, of course, we see going up dramatically in the next 10, 20 years, where there's an estimate of greater than 40% increase in the incidence of cancer. And overall, there has been some success, of course, in improving outcomes, where back in the 70s, 1 in 69 people became a survivor, and now it's 1 in 22 people are cancer survivors in our world. Now, the biggest thing that I find quite discouraging is that we know the majority of cancer could actually be prevented. And it could be prevented if people made appropriate lifestyle choices at different stages of their life. We know that at least 30% of cancer is attributed to tobacco, smoke, and other tobacco behavior. Nutrition, sedentary behavior is accounting for probably another 30% of cancers. And then we know there's a link between stress and social support and how that impacts our biology. And so what I'll do is go through some of these areas for you. We know, let me skip this slide. This is new data from the American Association for Cancer Research, AACR. You're all familiar with this. Same statistics from the American Cancer Society, National Cancer Institute, and other non-governmental organizations, where you can see here, as I just mentioned, 33% of cancers attributed to tobacco, obesity and overweight, 20%, 16% due to viral infections, etc. A huge amount of those are due to risky sexual behavior. 100% of cervical cancer, 75% of our head and neck cancers are HPV positive, again, due to risky sexual behaviors. And then you can see there for physical inactivity, poor diet, sun exposure. Easily 50% of our cancer incidence could be wiped off the planet if people modified their behaviors, if we had more of a focus on prevention. These same factors are critically important for patients after a diagnosis of cancer in terms of improving their outcomes. So integrative medicine is really about adding to the arsenal of medicine that already exists. So at MD Anderson, as I mentioned, we have a focus in clinical care, research, and education. I'll focus most of today on what we're doing clinically. We follow a very old model, but somewhat ignored model that George Engel published in the journal Science back in the 1970s that talks about health as more than just physical well-being. There's the psycho-spiritual that we just heard about, as well as social well-being. So, of course, in conventional medicine, physical well-being, and we're really targeting the tumor with the conventional treatments, chemotherapy, surgery, radiation, and now all the targeted therapies. But for us, physical well-being, we focus on nutrition, we focus on exercise, appropriate integration of rehab medicine, treatments like acupuncture and massage for symptom control. The psycho-spiritual well-being, again, we just heard about this, looking at the spiritual well-being of the patient, incorporating mind-body practices, relaxation techniques that can help to buffer sympathetic nervous system activation, and I'll show you why that's so critically important. And then the area of social well-being, making sure patients are appropriately socially integrated into their network. We know from research dating back to the early 50s by House and colleagues published in Science that people who are better socially integrated live longer. So we can have an impact on survival through things like social support. And all of this is overseen by, we have 2 integrative oncologists, and we actually have an open position for anyone who's interested in an oncology position at MD Anderson. And these oncologists work in this area that I've just described to you, coming up with the right prescription for the patient based on their individual needs and circumstances for achieving optimal health and healing, which we believe will lead to improved clinical outcomes. So I'll go through 3 areas that we really focus on: diet, nutrition, exercise, and stress management. In the area of diet and nutrition, one of the biggest challenges is patients will come in and say, well, I've kind of got the diet stuff covered. I just need feedback on my supplements and my herbs. And this, of course, is staged for this photograph, but this is what a patient was doing on a daily basis. And this is not an underestimate. Many patients are taking upwards to 80, 90 different supplements, some patients injecting themselves with unapproved substances. Now, there could be things on this table that are useful. There could be things that are more likely harmful, and the majority are probably just useless, and the patients are wasting their money. But our biggest concern, as should be yours, is there could be drug-herb interactions that could have negative implications for the patients. So we try and steer them away from looking at natural products for trying to find another pill as the magic bullet, because it's unlikely and there could be more harm than good. In particular, because most of the patients are leading very, very unhealthy lives, and they think that taking an antioxidant on top of eating fast food and processed food is somehow going to help their outcomes. So we try and orient them to their diet and do an assessment of their diet. And one thing we're particularly concerned about is their sugar consumption. And not just sugar, but a carbohydrate-rich diet. The standard Western diet is a diet that is not very healthy, and it is very high in glycemic load. So here you see what's happened with sugar consumption in the United States, very similar actually throughout the world, where there is a huge amount of added sugar in everyone's diets. It's hidden in the foods, it's primarily in processed foods. Obviously, if you have whole foods, you're not going to be getting this huge sugar exposure. Why we're concerned about glycemic load is emerging data and the emerging science behind the role of glycemic load in risk of cancer and influencing outcomes after a diagnosis of cancer. And you can see this. I'll show you a number of graphs that show these hazard ratios from epidemiological data. You're all, of course, familiar with seeing this kind of data. Here we see increased risk of 80% for those individuals in the highest glycemic load and risk of breast cancer. Everyone's familiar with the IGF-1 pathway. This is a very important pathway in terms of inflammation and, of course, cell growth. Direct link between IGF-1 levels and prediction of survival after a diagnosis of cancer. And this is across a number of different cancers. You are all also aware that metformin is currently being investigated as a treatment for cancer. So why would we be interested in metformin if there wasn't something around this balance of insulin glucose pathways within the bodies? So this is something that there is an easier way than taking metformin. It's about having a healthy diet and trying to get excessive glycemic load foods and glycemic index foods out of the diet. The other thing that we focus on is the kinds of oils, and here in particular you see what's changed with one particular oil in terms of consumption per kilogram per person per year since the 1970s, this dramatic increase. And this is soy oil, which is essentially omega-6 delivery vehicle. It's an inflammatory fatty acid, and you need it. You need inflammation during certain times, just like you need anti-inflammatory fatty acids, as everyone's familiar with the omega-3 fatty acids. But when you have this tremendous imbalance between omega-6 and omega-3, which is the standard American diet, is loaded with omega-6 fatty acids, the bodies are under constant inflammatory load. And all processed foods and all fast foods are loaded with omega-6. So this imbalance, of course, has resulted not only just from the fatty acids we eat, but the kinds of foods that we eat, and a serious problem with an obesity epidemic that, of course, has started in the United States and in the West, but is being exported to the rest of the world. So here we are in 2012, of course, the U.S. and Mexico leading the way, but many other westernized countries. France is down here in the middle, but as you'll see on this next slide, continuing to rise. So the prediction in France by 2020 is that close to 50% of the population is going to be classified as obese or overweight, and of course worse for other countries. There is a diabetes epidemic in India and in China. The Chinese are gaining weight, but they're getting diabetes at a much lighter weight. So all these same inflammatory pathways are going to be increasing the incidence of cancer in a staggering way. We know there's a direct link between obesity and cancer, both the risk of cancer and unfavorable outcomes after a diagnosis of cancer. This comes from the American Cancer Society, and I won't go through all the details here, but they estimate that up to 40% of the most common cancers can be linked directly to obesity. Luckily, ASCO and many organizations around the world see this realization, and that oncologists really must start playing an important role in helping to guide and counsel patients in this area. So this is what we do with our patients. We talk about food as a therapeutic agent, that there's foods that can be carcinogenic, and then there's foods, of course, that have many anti-cancer phytochemicals. There's epidemiological data showing that more focus on a plant-based diet will lead to better, reduced risk of developing cancer. You see that here, comparing vegans and vegetarians to individuals who are more omnivores, where there's a decreased risk. After a diagnosis of cancer, this is more than 2,000 breast cancer patients. Those who eat more vegetables have a lower probability of recurrence of disease. So do we tell our patients they must become vegetarians? One line saying to the other, I'm trying to eat more vegetarians, and we don't. But what we say is that people need to eat more of a plant-based diet. They need to decrease the amount of animal proteins. They have to have healthy fats and have much more plants in their diet and going to the plant world. This is the recommendation of the American Cancer Society, American Institute for Cancer Research, yet it is not part of the standard of care, even though the data is quite overwhelming. The area of physical activity, we'll go through this a little bit faster. This is something that every single oncologist and physician in the world needs to be prescribing to patients. The evidence on the benefits of exercise and the harms of sedentary behavior are now overwhelming. A series of papers last year in The Lancet estimates that the harms of sedentary behavior are equal to the harms of smoking. We have huge campaigns about smoking in our world, and we have nothing really about getting people physically active. All you have to do is walk an hour a day, as you can see here, and you have a 15% reduced risk of developing breast cancer. After a diagnosis of cancer, this is some of the more recent data, link between physical activity and recurrence of survival from colorectal cancer. You see pictured here, close to a 50% reduction in survival. Same is true for breast, for prostate, for malignant glioma, for some airway-related cancers. The majority of cancers that you look at, you see this link. And as I mentioned, sedentary behavior is important on top of physical activity. This is data just published earlier this year, looking at more than 92,000 individuals. Risk of protection from coronary vascular disease as it relates to the amount of decreasing of sedentary behavior. The more the sedentary behavior, the higher the risk of deaths. Same with cancer, 20% increased risk of death due to cancer for those who are the most sedentary in this population-based study. Turning back to that colorectal cancer study, 25% increased risk of death for those who are the most sedentary, independent of their physical activity. So they controlled for how physically active somebody is. So it's not good enough to say, get out there and walk for half an hour a day, an hour a day. You also need to reduce sedentary behavior. The area of stress, this is the area that's the most challenging for our patients and for us, I believe, as a society. It would be ideal if we could give everyone easier jobs and a smaller house and give them different families that don't give them stress. But of course, this isn't something that we can easily do. And why this is so important, every single study that's looked at the effects of chronic stress on different biological functions unanimously show whatever biological measure you take out of the body, it's negatively impacted by stress. And I won't go through all the details except to highlight that stress shortens telomeres. And everyone in this room is familiar with what telomeres are. I don't have to go through the details. That means stress is speeding the aging process and increasing risk of many different diseases. However, the study of risk of stress as an etiological factor is quite challenging, and we focus more on working with patients, of course, after a diagnosis to try and decrease stress, because the animal literature is overwhelmingly convincing that you can see pictured here that the size of a tumor and the spread of the disease throughout the body of these animals is quite profound for those exposed to stress. And the animals who are exposed to stress and given a beta blocker block the effects of norepinephrine, block the downstream release and impact of stress hormones. It's as if the animals weren't exposed to stress. So there's a lot of research that's going on because we're quite reductionistic in a pill-based society looking at pills to decrease the effects of stress. That, of course, will ultimately be problematic in the long run, but there are many things that we can do to help improve outcomes, to help treat things like depression that we know are linked with survival. A recent paper that we have just published in Cancer Epidemiology, Biomarkers and Prevention looked at depression as well as telomere length and found that if you were the most depressed at the time of diagnosis that you see pictured here and you had short telomeres, your survival time was dramatically reduced. So there was a significant difference just between depressed and the not depressed, independent of telomere length. But then if you had this double hit of short telomere, again, we know that stress decreases telomere length. It's something that we really need to work on. So, you know, I can't go through all the details here of the link between stress and biological functioning, but suffice it to say the evidence is very strong that there is a direct link between chronic stress and what's going on right at the tumor microenvironment. And this is something that we really need to help patients to short circuit. Let me jump through details of our ongoing research. We have focus in these 5 different areas, and I'll show you some very important data, which is what happens when we talk to patients about incorporating all these different factors in their lives, about modifying their exercise, their physical activity, sedentary behavior, modifying their diet. This is data from the American Cancer Society, over 65,000 non-smokers. So smoking is not part of this equation here. And the more guidelines, some of which I just described to you, they also recommend moderate alcohol consumption, decreasing red meat, decreasing exposure to processed meats. Again, the individuals following 7 to 8 of these guidelines had a 20% reduction in even the risk of getting cancer. And then the specific cancers, we see the risk is decreased even more, 50% reduction in risk of even getting colorectal cancer for those who are following the most guidelines. Similar curves you see for mortality, and for some cancers, a greater than 60% reduction in mortality from colorectal cancer. Again, the more guidelines that you follow. So this is an area that we're focusing on because there are not a lot of clinical trials looking at comprehensive lifestyle change. Barbara Anderson did a trial of over 200 stage 2-3 breast cancer patients, comprehensive lifestyle change versus usual care. This was published in the journal Science a number of years ago. Primary outcome was powered for recurrence of disease, 60% difference between the control group and the intervention group for recurrence of disease from a behavioral intervention. And you can see the survival curves for overall survival, breast cancer survival. So this is something that we've embarked upon. We started a collaboration with David Servan-Schreiber before his untimely death 4 years ago, and are doing a comprehensive lifestyle change study together that we were able to raise millions of dollars from philanthropy to guide patients to see if we can dramatically change outcomes by taking a more integrative approach. We're targeting specifically stage 3 breast cancer patients that have worse probability for outcomes, and are hopeful that this study, as well as others, could really change the landscape to have integrative care really be part of comprehensive oncology care. Thank you.